And then we make the V-shape pattern where the tunnels will be.
Dr. Peter Driscoll just came to Austin from Louisiana and brought with him a new way to make breasts bigger.
This is the pathway for both tunnels, and we'll go under the muscle right here.
Instead of cutting a woman open at her breast to insert the implant, Dr. Driscoll puts them in through her belly button.
The doctors who are in training now, they're really the ones learning it, because there is a learning curve with this. This is not something that you can learn in a weekend course.
The procedure has been around for more than 10 years, but not in Austin. It's popular in places like LA and New York because surgeons claim, unlike other breast implant procedures, this surgery leaves no visible scar. This is an electric knife normally used for breast implant surgery. Dr. Driscoll demonstrates for us using a chicken. The burning stops the tissue from bleeding.
You can imagine if you did this to your hand, it would hurt for a good week or two. And that's the whole point. We're able to do this procedure without this.
I've been thinking about probably ever since I was close to like 17 or 18, so a couple years now.
Megan is a patient of Dr. Driscoll. She grew up in the Austin area. Megan wants bigger breasts. She wears a B cup now, would rather have a full C or a small D, but she's not willing to take weeks to recuperate.
I don't want any scar, and with this surgery there's no scar, and I don't want to have any kind of scar or pain, and my friends that have been here before have returned to work like within the next day.
We didn't tape the actual surgery, but did join Megan as she got ready for it.
The first step we do is we make the little incision in the belly button. This is what we make our tunnel with. And it doesn't cut, but it has a little tip to it, but it doesn't cut anything. And I sort of bring up the skin like this, and I just kind of milk it through.
The doctor then inserts a sizer through the tunnel and inflates it with air to form a pocket in the breast. It also stops the bleeding, the same thing the electric knife would do.
Once that's done, I take that out and I place the implant the same way. And then out on the outside, this is salt water, saline. I inject this into the implant and it just fills up.
The whole procedure takes about 30 minutes. So how about the price? Well, Dr. Driscoll says to get the breast implant through your belly button costs the same as typical breast augmentation surgery, which involves more scarring and burning. And that cost is around $5,000 to $6,000. So is it worth it? How are you doing?
Hey, doing good.
Good. We met up with Megan the day after her surgery to find out. That's the black marker that he drew on you, and that's where he went through.
And then this is where he went through.
And Megan says besides that, there's no marks on her body, and she's happy with the results.
I'm feeling pretty good, just a little bit sore, but that's about it. Just a little bit sore in the breast area and a little bit on the stomach, but that's really it.
Jenny Hoff, KXAN, NBC Austin.